Well, in January, a few weeks after the competitive bidding program had started, which we had not won any of the bids, competitive bids, we were not awarded any contracts, I guess I should say. A patient of ours called up. She is an MS patient. She's had a power chair from us for several years, and her chair was not working. It turned out it was just a dead battery, but could we please come out? And we explained to her that we could not, that we were no longer able to come out and provide that service for her. And we had done a lot of different work for her over the years, so she was a long-term customer of ours. So we told her to call 1-800-MEDICARE, which is what we were instructed to tell people. So over the next 3 weeks, we were talking to her, and she was calling Medicare, and still 3 weeks later hadn't found anything and was bedridden except for to get up to go to the bathroom. So here she is sitting there, can't get out of her bed except to go to the bathroom, can't move around her home, and all she needs is a battery replaced. So there's a woman who spent 4 weeks in bed because we couldn't go out that same day or the next day and replace her battery. And we're getting these kind of calls all the time. And we're telling people this is what you need to do. You need to be calling your congressman. You need to be actively calling Medicare and complaining to them, because they just can't keep saying that there's not a problem when we're living in this problem. And our patients, the tough thing for us is that a great deal of our patients are elderly people. They're confused on a good day by a lot of this kind of stuff, and the billing and all this goes on. So when we try to explain this to them, they don't understand. And that's because it's hard to understand. I'm offended when I hear CMS putting out statements that there are no problems out there, when we're getting calls on a weekly basis from therapists, daily actually, from therapists who we had dealt with, who referral sources, who don't know who to go to. We have facilities who have turned away all their referral sources to home health care agencies because they no longer want to deal with the problem because it became such a nuisance to them.